Hello everyone, I'm Dr. Prashad here on behalf of Woodlands Limited to help raise awareness on three common urological cancers found in Guyana. And these are prostate cancer, renal cancer, and testicular cancer. So let's jump right in and start with prostate cancer. Prostate cancer is one of the most common cancers found in Guyana. All men are at risk, but a man is at an increased risk if he is over the age of 40, of Afro-Guyanese descent, or has a family member with prostate cancer. Even though it's so prevalent, the good news is that once detected and treated early, there's a good chance of survival and even removal of the cancer from the body. To help fight against prostate cancer, screening is what is recommended. A screening process involves a man seeing his urologist before any symptoms develop in order to gauge his risk for prostate cancer. In Guyana, it is recommended that all men over the age of 50 start seeing their doctor to evaluate their risk for prostate cancer and start that screening process. If, having completed the screening process, a man is determined to be at a higher risk for prostate cancer, a prostate biopsy may be recommended. This is where an ultrasound and needles are used to take samples of the prostate, which are then sent to a lab to be tested further. Should a man be diagnosed with prostate cancer, there are many resources available locally to aid in treatment and to help that person live a long and as comfortable a life as possible. Renal cancers are another common urological cancer seen in Guyana, and like prostate cancer, there are really no early signs or symptoms of this condition. In fact, the majority of these tumors of the kidneys are incidentally found when someone does an ultrasound or a CT scan for some other reason. Persons are at an increased risk for developing renal cancers if they smoke, have high blood pressure, or are obese. The best way to protect yourself and detect renal cancers early would be to have your regular visits with your doctor, who will periodically screen by doing ultrasounds or other imaging tests. Should you be diagnosed with a renal cancer, the recommended treatment is usually some form of surgical removal by a urologist. The third urological cancer I would like to mention is testicular cancer. And this is reasonably unique in that it tends to affect younger males. So the highest incidence occurs between the ages of 20 and 30 years old. This is usually discovered when the man examines himself and discovers a growth or some form of abnormality in the testicle. As with many cancers, the earlier testicular cancer is detected, the better the chance of survival and even cure. Men are encouraged to examine their testicles in between regular annual doctor's visits. If any abnormalities are noted, there are several tools that can be used to further assess this. This usually would involve an ultrasound and perhaps some blood testing. If a man is diagnosed with testicular cancer, then it is usually recommended that the testicle is removed. It should be noted that a man can live a normal life and have normal reproductive and sexual function with just one testicle. So that's a really quick overview of three common urological cancers seen in Guyana. And even though cancer can be a really scary topic to think about, do remember that we've got many tools and resources available locally to screen, diagnose, and treat all common cancers, which will ensure a long and healthy life for you. And on that note, I am Dr. Prashad, consultant urologist at Woodlands Limited, encouraging you to utilize the information and services that are readily available and to help you ensure a healthy life. Have a great rest of your day.